If everyone can take your seats, we're going to get started up again. Okay, welcome back from break, everyone. I hope you all were able to connect with one another and have some good conversations, which can also continue after the symposium. I'm pleased to welcome to our stage our second panel, and I'll be introducing the moderator, who is Nicole Benham. She is the Senior Orphans and Vulnerable Children Advisor at PEPFAR in OGAC, and she will be introducing our panelists. So welcome.
Well, good morning, everyone. I am delighted to be here. It's so wonderful, actually, to be a part of this panel because it's something that's very close to my heart. And this panel is going to be about how social service workers support and equip community members engaged in child protection. And as Mike knows, we've had many, many conversations about this in the past. And for us, I think it's a very, very important part of the work that we discuss quite a bit, but that often gets overlooked in implementation. Although I was delighted to see in the last panel how much of that was really happening at the community level as well. You know, we know, I'm not going to say much here because I really want to get right into the presentations, but we do know that it's really at the community level that things happen or don't happen. The community can either be a doorway to a response that brings healing and hope for children, or it can be a bottleneck that either ignores what's happened to children or even promotes a response that's very unhealthy and unsafe for children. And so it's a part of this whole system strengthening. We often go towards the formal. We think about the very formal systems. We forget about what happens informally all the time. And this is something that I know Mike is going to talk a lot about as well. But actually, I should introduce the panelists. This is Dr. Mike Wessels, who's a professor at Columbia University and so much more than that. So please do read his bio. And also we've got Mr. Patrick Onyango Mangen, who is the country director of TPO in Uganda. And we're going to have some brief presentations from them about between 10 and 12 minutes. And then we really wanted to have some a good amount of time for questions and real dialogue. So we'll come back to that. But in the meantime, I'd like you to help me welcome to the podium Dr. Mike Wessels.
Thanks very much, Nicole. It is a real pleasure to be with you this morning. I feel like we're having a dialogue across different tribes and different disciplines. So I'm a lifelong worker in the field of child protection, and have spent most of my adult years, or quasi-adult years as they may be, working in large-scale emergencies, typically settings of armed conflict. But I think that some of the lessons are relevant, and so I'll try to share some of those with you. I was asked to talk a little bit about how do we go about preparing a workforce to actually support the good work that communities already do to protect children. As Susan said this morning, and as Nicole pointed out, it is families and communities who do the lion's share of work. They are the ports of first call, and they're the people who do the heavy lifting with regard to child protection. So when we think about strengthening child protection systems, building a workforce, we have to think about supporting what communities already do. But we need a little bit of humility when we take this topic on because, first of all, there's a very weak evidence base regarding community-based child protection mechanisms. We know a bit more about the things that NGOs and governments do, but what do we know about the endogenous mechanisms, the sort of spontaneous, homegrown sort of efforts that are very sustainable and often quite effective? You have to excuse me, the pollen is affecting me this morning. That means that there's also there's a corresponding paucity of evidence regarding who actually supports those community-based child protection mechanisms. We tend to focus on professional social workers or on paraprofessionals, which of course are hugely important. What about the religious leaders? What about the youth workers? What about the grannies, who oftentimes do a lot of work not only on behalf of children directly, but on behalf of community mechanisms? What do we mean when we talk about community-based child protection mechanisms? Basically, we mean formal or non-formal groups that work at a grassroots level to monitor, respond to, and prevent child protection issues. On the more formal side, governments or NGOs may set up child protection committees or child welfare committees, groups of maybe 10 or 15 people, adults and maybe some teenagers, who are selected precisely for their ability to monitor and respond to various kinds of threats to children, whether it be violence, abuse, neglect, exploitation, and so on. But there are also endogenous mechanisms. And I would say that as child protection workers, we have not always, and I include myself in this, we have not always done a good job of listening and to local communities and learning what's already there. What are their challenges? How do they understand who are children? How do they understand what are harms to children? What do they do in response? So traditional courts of justice, faith-based groups who form to help children affected by HIV and AIDS, they may not even use the term child protection. They may not view themselves as any kind of formal workers, but their support is absolutely crucial. These endogenous groups are profoundly important, but I think it's also important not to romanticize and to recognize that sometimes they embody local norms that are a mixture of positive assets to support children and sometimes include harmful traditional practices. So we have to keep a critical eye out. Several years back, I had the honor of leading on behalf of the Interagency Learning Initiative, which is a coalition of about 20 NGOs and donors and government agencies trying to strengthen community-based child protection mechanisms. We did a review of the effectiveness of community-based child protection mechanisms, and we found a horribly weak evidence base. But for the evidence that was there, we were able to discern on a provisional basis 7 effectiveness factors that contributed to effectiveness and sustainability. And it won't surprise you that the number one factor was community ownership. To the extent that communities said, this group is ours, this is our mechanism for fulfilling our responsibility and our obligation to our children, that led communities to pour themselves into the work of that group and to find ways to make them effective. And they were oftentimes done without funding and were really quite sustainable. These other factors we can come back to maybe in the discussion. But as a footnote, we were able to analyze the extent of community ownership that was generally achieved by NGO-led efforts to form child protection committees. And what we found generally was low to moderate levels of community ownership. At the end of the day, most people said, oh yeah, that's a UNICEF project. That's a Save the Children project. And so they didn't take it as their own. And there's a big loss as a result. Well, I wanted to suggest that when we think about the role of service workers, we need to think about the non-formal actors as well as the formal actors. And at the broadest level, I think we can think about the importance of supporting what community mechanisms already do. That means we have to map them and have to know what they are. And that is very seldom done. It means identifying and supporting natural helpers, engaging in some deep listening and learning about social problems, their root causes, and about the local assets and resources. Who do people naturally go to for help? If there are workers on a faith-based committee to help people affected by HIV and AIDS, who supports those workers? These are questions that haven't been asked quite enough. The importance of accompanying and supporting the community is crucial. Oftentimes workers are viewed as experts who are somehow positioned above the community. This gets it all wrong. There needs to be a process of being one of the people and actually helping communities do what they already do only more effectively. We need a stronger emphasis on prevention and resilience, because so much work in child protection has had a responsive focus, which of course is important, but we can't afford to sit back and wait for the horrible things to happen and then pieces later. There's a lot of education and capacity building, but I'm going to argue that this should not be necessarily in a top-down modality. It ought to be in a more respectful lateral process. And the workforce needs to have a leg in two worlds: the world of child rights and modernity, and the other leg needs to be where local people live, with traditional understandings, with local beliefs and practices, and they need to be able to navigate that world and to find a way to negotiate and to make an appropriate balance between them so that we align the formal and the non-formal. And then where harmful practices exist in communities and families, we need to think about social norms change. UNICEF and some other agencies have pioneered a methodology for changing harmful traditional practices, not by black letter law, not by imposition, but by finding the internal change agents, feeding them information, enabling them to expand their networks, to identify alternatives that are positive to practices such as female genital mutilation and cutting, and then developing and promoting those more helpful alternatives. Most workers are not trained to do this kind of thing, and the international funding often works against us, because funding that's given in short tranches does not achieve long-term social change, which is often measured in blocks of 5 years, 5, 10, or 20 years or longer. In Sierra Leone, I'm involved in some action research with communities in which we started with ethnography. Communities identified what they saw as the biggest harms to children. And they didn't say things like female genital mutilation, which is very widespread in Sierra Leone. They said things like teenage pregnancy. And it turns out that teenage pregnancy, about a third of them stem from sexual abuse and exploitation. Communities themselves, meaning youth, girls, boys, men, women, leaders, and in a very inclusive process, chose to address that problem through Marie Stopes, after all, is Sierra Leonean, family planning, sexual and reproductive health, and life skills, and all done in a very community-driven modality. We literally don't have a manualized kind of approach. It is something that is done using the vigor and creativity of youth groups who go out and do dramas and do lead discussion groups and peer educators who advise on a daily level. But some of the changes we're seeing are really quite dramatic. Health workers at the health post said that before this, they were never invited into communities. So the uptake was low. And I would say that as an enterprise, strengthening the workforce has too often been characterized by high on capacity building, low on uptake. We need to turn that around. The uptake was the big impact that has been achieved so far. Now the community health workers are seen as people who help the community solve its problems. They're invited into the community. They're treated even with an element of reverence and a lot of respect. So if we create a community-driven approach, I think we get much farther with regard to the utilization of services. But what this means is if we need to rethink the orientation, the skills, the attitudes and behaviors of the workforce. So oftentimes there's been an emphasis, for example, in sub-Saharan Africa, on training people to be quite expert at case-based management, which of course is a very important piece of government-led work. But typically the social workers view themselves as positioned above the people somehow. Oftentimes people are office-centered. They don't spend much time in the community. When you ask people in an unprejudiced manner what they think of government social workers, they'll say, well, those guys that come out here, they are not one of us, and they use too many resources. They eat our food, they stay in our places, and they really, at the end of the day, are not seen as helping very much. Where NGOs come in and try to help with some social workers, they oftentimes engage in facilitation, but it's a rapid facilitation of social change, a sort of facilitation. And I would argue that there's too much imposition that's going on. What we need is a cadre of workers including non-formal workers who are co-learners, one of the people, who engage in real power sharing, who do psychosocial support not because they're trained counselors, but because they're empathic and respectful. They're prevention-oriented. And they're concerned with community outreach and supporting the non-formal. And where there are harmful practices, they are agents of social change. And they take the slow, patient approach to facilitation. This is hard, hard work. And so I think it requires a different approach. And to do this work, I think it requires a highly reflective orientation. It's not just about being an expert. You've got to think of power. How am I positioned relative to local people? Is it really about the well-being and the activities of children and families, or is it about the number of cases that I have and the number of referrals that I'm making and the interventions that I'm doing? At the end of the day, the next generation of workers could have a much bigger impact if instead of focusing quite so much on cases and what they're doing directly to help children, if they focused on helping the natural helpers, helping the community groups that are already there. That's not to say they should abandon their casework. That's going to continue to be enormously important, but there needs to be a better balance struck. If we do this, then I think at the end of the day we'll be in a much better position to fulfill our obligations to helping the world's children. Thanks very much.
Thank you, Mike. That's great. And so now we'd like to hear from Mr. Patrick Onyango-Mengen from TPO.
Good morning to you all. I was asked to share some of our experiences on how we've worked with local community groups as well as individuals and built their capacity to care and protect children. So I'll be sharing with you some examples from the field. And the first example is from Somalia. So with support from UNICEF, for over 6 years, we worked with selected local community groups, some of those similar to what Mike has been describing, to deliver child protection and psychosocial support services. The context of Somalia, as many of you know, is a very complex, hard-to-work-in context. And I just give you some examples there. It's one of active conflict, widespread civil disorder, inexistent social service delivery structures, gross rights violations on women and children, and a very strong, closely knitted and influential clan system. So our task was then to identify and build capacity of 12 grassroots organizations, which were not formal at all, loosely organized youth groups, women groups. And the interventions we came up with was, first of all, to map individuals within communities, associations and informal groups involved in child care of whatever form. The criteria wasn't any basic qualifications. We're looking at people who were empathetic, people who were willing to help, and who had volunteered before. And the approach, therefore, we selected over 20 individuals that had been recommended by communities and vetted during the mapping as credible. And then we also identified 50 trainees affiliated to community self-help groups. These could have been secretaries of the groups or the individual that started the group. Some of them were local CBOs, and we identified these for training. So we brought about 70 of them to Uganda for an intensive 3-week field-based training, sharing the Uganda experience in the north, working with children, psychosocial care and support. From this group, we selected 32 that were capable of training others as community facilitators. And from this group, we looked out for those that had leadership skills to be able to manage local CBOs. The minimum criteria for this was slightly higher up, knowledge of basic writing skills, English, and completion of secondary level education. And so the 32 were further trained as trainers. The training took a cascading approach. 8 dropped out of the course, and 30 were retained as caregivers. These were then attached to local CBOs, and where CBOs did not exist, we encouraged them to come together as a group, and then they decided to form these CBOs. So in all, we ended up with 12 CBOs, which were formally incorporated. Working with UNICEF, we started extending sub-grants to these CBOs, ranging from $25,000 to $50,000 a year or over a 2-year period. So sub-granting included project administration, financial capacity building, and we moved out after 5 years. And before I came here, I've been in touch with about 8 of these CBOs. The rest probably dropped out or went into different things, and many of them are still continuing with this work. The curriculum and training materials we used were non-accredited psychosocial and child protection training materials that were largely adapted from the Ugandan context. The second case example then is still a very hard to reach, hard to work in community in Uganda. This is a semi-arid community. They're normally nomadic pastoralists. You hardly get many NGOs and foreign staff working in Karamoja. There are 2 doctors and 3 social workers for over 30,000 people, and widespread harmful traditional practices. Again, our task, building on our Somalia experience, was to establish a community-driven child protection system, building capacity of parasocial workers and supporting them to form CBOs. Probably different here is we're not targeting individuals, because you target individuals and they go into different things. So we're looking at small entities that could begin the process of forming social capital that is more sustainable within these communities. The curricula this time was quite different from what we used in Somalia. We had learned from the Somalia experience, and this time we teamed up with REPC and worked with them to introduce the distance learning course for children and youth, which is accredited to the University of KwaZulu-Natal. I think this was mentioned before. And here, this is just a picture that shows you the kind of environment these groups work in. They meet regularly, they plan together, and they discuss their action plans. This is a quotation from one of the alumni who trained. The training is about 18 months. Half of that is probably field-based, and all the modules, the 6 modules, are all distance delivered through distance learning. And Francis here, he just says, first of all, I never had an opportunity for an education. The knowledge gained from the course enabled me to get the job at the hospital as a child caregiver in the social services department. Now I also do community health education, communicate with the children and parents who come to the hospital about parenting skills and care for OVC. And he also raises awareness on the needs of children. These are some of the clan leaders interacting with the trainees, and you can see the environment in which they reach. It's very, very hard to reach, extremely remote, and traditionally managed. And the CBO is formed bottom-up from this example. And Rhoda, who is also one of the alumni, together with 4 other colleagues, formed the women's NGO called Maendeleo Women's Group in Karamoja. And she had this to say about the cause. I only possessed a secondary level education, but had always wanted to help children in my community. This course gave me the opportunity to do that. After the course, we formed our own CBO, which TPO helped us register. We now have a constitution, we opened up a bank account, and manage small grants from TPO, from ZOA, and many other agencies coming to us for community work. And so we took our experiences from these trainings, which were not accredited, and together with the CPC network, we embarked on an interagency process of developing a professional child protection course unit in Uganda. And this 3-year process drew participation from academia, practitioners, and government policymakers. The main aim was we had recognized that working with the community groups, the community caregivers, the loosely formed networks of these community groups, we could work with them closely to bring the services in areas which were inaccessible. However, the training had to be of a certain level. Some of the materials we're using were not accredited. And therefore, we developed a prototype child protection course unit, which was later accredited by the local Ministry of Gender and 3 public universities in Uganda, including Makerere, Chambogo, and Nsamizi. This course unit was then split into 3 levels, all targeting specific student populations. The first integrated the course unit as an elective into a social work degree program, targeting entry-level social workers. The second integrated the course unit again as an elective for the master's degree in social sector planning and management, targeting policymakers. And then the third was an in-service training course targeting professionals already working in government and the private sector. Whereas the first two were integrated into 3 existing university programs, it came at no extra cost. Initially we thought and said, well, should we form a standalone child protection course? But then you need to popularize it, you need to market it, and it comes at extra fees. So integrating within an existing program seemed very cost effective for us. To date, the course has now trained 3 student cohorts, so far targeting over 300 students and policymakers each year. And these materials have then been adapted to train community-based caregivers under the PEPFAR supported projects, the OVC Sunrise project and the SCORE program. For example, Sunrise adopted these materials and has so far trained 1,300 community development officers and close to 2,000 parasocial workers. The CDOs in turn supervise the parasocial workers, and while SCORE has used these materials to train close to 200 community-based caregivers supporting vulnerable children. The training is for 2 weeks classroom and 1 week field placement, and the certificate is now issued by local universities. The pitfalls have been spoken about. I don't want to go through those. I think Linsk and the others have talked about those. There's a need for regular support supervision. Like Mike said, you need a balance between what we look at as the rights approach and what the communities traditionally practice. Regular supervision is very critical, but also working with informal community structures probably is more effective where you have referral networks, because their capacities are limited. There are certain cases they cannot handle which need to be referred. But what they do well is follow-up and so on. And then refresher training and orienting them periodically on new practices and the laws and what ones are out there. And lastly, trainee selection has to be detailed, taking into consideration character, voluntarism and empathy, but also looking at issues of do no harm and working to ensure the best interests of the child. Thank you very much for your attention.
Thank you. As you can see, we have very punctual presenters. So we have some good amount of time now, I think, for Q&A. I want to open it up for questions, and also just to remind you, we really do want this to be dialogical, but we also would like it to stay to questions and not long commentary so that we can get a lot of questions in the amount of time that we have. I don't know if we have any also from the webcast, so please just let me know if there are any. So I'd like to open it up. Go right to Gretchen.
Need it, but so I'm Gretchen Bachman, and I work at USAID on the PEPFAR project. And for both the presenters, but picking up on something, Mike, that you were talking about, you said that about 1/3 of the cases of teenage pregnancy you suspected were forced, and but the community response thus far has been reproductive health services and counseling and life skills, which is wonderful, but to me doesn't necessarily. You know, I can talk all I want, but that doesn't protect me as a young girl. So how is the community looking at those situations where, you know, those things aren't going to help?
Thank you, Gretchen, for that question. When we do community-driven work, we are faced with a lot of challenges like this. As a child protection worker, I'm trained to jump in and to say, no, you've got to stop that abuse now. But it doesn't produce any real community ownership. I found myself biting my tongue and being really afraid that they would not take on the abuse. In fact, they took on the abuse, but they had the presence of mind and the understanding not to start with that. Why? Because the abuse was committed mostly by men my age in positions of power. And to confront them head on would be to make your life worse and more dangerous. And so if I could give one example, when we fed information from the ethnography back to the communities, community said, you got it right, you know, it was some degree of validation. And then they asked, what are we going to do about it? And in one village, they decided to pass a bylaw. And I have had a lot of doubts about bylaws because so often they're not enforced. But in this case, this particular community went around and every family said, our girls are being abused. And it's often by older men and even by teachers. And they said, this needs to stop. And the chief went around and asked the head of each family to personally sign on in public, sign on verbally. So about 2 months ago, a 55-year-old man abused a 15-year-old girl in that village. And following the usual custom, the perpetrator walked over to the chief's house with animals in tow, cash in hand. This is the way it was traditionally done. And the chief refused to talk with him. The man brought his brothers over. And following a cultural script I hadn't even known about, excuse me, they wailed. They groveled in the dirt. They demonstrated profound apology and subjugation. But at the end of 3 days, the chief came out on his veranda and said, your family was there the day we, as a village and every family, agreed that this has to end. You're going to the chiefdom jail for 2 years. Now, the child protection worker in me says, well, that's just a slap on the hand. But this was something that had never happened in anyone's living memory. And it was a process of community change and community ownership. So I think, I don't want to claim that it's always going to go this way, but I think that there's a process of trust and learning about how people on the inside will take on these issues. And I would say that if they had taken my approach of saying, take on that sexual exploitation, they wouldn't have gotten anywhere near that far. So I think we need to just try to document, try to encourage, and then take these learnings and share them laterally. So a lot of what we're going to be doing over the next months and years is helping these communities that have transformed themselves share with other communities. And because there's always the question of how do you scale this up? But Sierra Leone is a good example of a country that is scaling up. They have a new child and family welfare policy that is taking this issue of community ownership seriously. And my view is that communities are the best teachers of us. Why shouldn't they teach each other and learn from each other? So that I think that this is the way it will go. Thank you.
Okay. Other questions from the audience or from online? While we're waiting, I just, and please do, question, comment. I did want to mention what I like about both of your presentations is the emphasis on the humility and the co-learning, because I think, and again, also as a child protection worker, it's very, very difficult to hold back when you see that kind of thing happening. And yet, if we really want these things to be sustained and be effective in the short and the long term, we need that co-learning, we need that humility and patience. Certainly there are certain situations where you have to jump in for the safety of the child and do something, but that sort of meeting of the minds that has to happen. And I think Sierra Leone, and again, also Somalia and Karamoja, I mean, you guys have picked some of the most difficult places with some of the deepest child protection issues to highlight. So I mean, way to go to take a deep dive here. I'm really, you didn't start with the easy stuff. So, so please, more questions, but if not, I'd also like you to talk a little bit more about the research that you're working on.
Sure.
Are there any other questions before we go there? Because we really wanted to make sure there was time.
Sorry, I know I'm a question hog. I would love for you guys to talk about, because we had, oh, sorry. I was
You're loud, but you're not that loud.
I'm going to try and sneak it in. But no, I think it would be really helpful because, earlier we were hearing about all these programs to train social workers. And from what you're talking about, that acceptance at the community level, and how do we get within the trained workforce that understanding of the community mobilization and role. And so I would love to hear from both of you, and especially from Patrick, how you're crossing that bridge between informal and formal, traditional and formal systems, and how can we do that better?
Thank you. And those are challenges we face very often in doing this kind of work. And in many ways, we find the formal sector, they don't entirely appreciate the role of the informal sector. So that's a starting point, getting them to realize that the youth groups, the women's group, the informal groups actually do a lot of work. These are the ones who do the day-to-day contact. They do home-based care, but they also do referral. So one of the entry points we're trying to, promote is let each of them do their own piece, and let the informal sector not, make like they are able to do the work of a medical assistant at the village level, but let them collaborate through referrals, through follow-up, through community-based education, but also sharing their understanding of the local context and cultural practices. As far as the training is concerned, I think it was in Dr. Linsky's presentation about the career ladder, and I see difficulties, as far as getting these informal trainees to ascend that ladder, because those qualifications are not recognized within the university system. So some of the courses we've developed for the formal in-house training courses are really targeting those with basic education that can then upgrade. And yes, of course, there are some cases where the informal trainees have gone on and embarked on, but it's long-term study. I mean, this certificate course alone is 18 months. You would probably do 2 postgraduates within that time, but it takes a long time, and it's a bit, very expensive for them to do that. Yeah.
Yeah, just to chime in a bit, I think many times the workers who are hired do not live in the actual community. To be of the people is really, really crucial. And I'm not opposed to the idea of social workers, and others and paraprofessionals coming in, but at some level what we really want, I think, is immediate access. And as Patrick says, this ability to navigate dual worlds. And I think that without living there, people won't have the respect for the local traditions. So let me be critical for just a moment. People like us who are university trained and people in country who are relatively well educated oftentimes harbor fairly deep prejudices against traditional beliefs and practices. They are literally more Western than we are. And they oftentimes aspire to science, which has a tremendous age. And of course, I mean, we think it's wonderful, but sometimes it's seen as a cure-all when there's a lot of basic human compassion that does not have to be driven by science. Science can support it in certain ways. So I guess what I'm saying is that oftentimes we create a workforce of outsiders who are not sufficiently informed by local traditions, nor do they feel comfortable in that world, and they're certainly not accepted by it. And so the end result is that they're poorly positioned to be social change agents. And they end up engaging in what I would call impositional behavior. You come in with a child rights agenda, you teach people that they have their rights, and I've spent most of my life promoting child rights. I'm not at all an opponent of child rights. But in Sierra Leone, what we found, we just simply asked people, what are the biggest harms to children? One of the top harms to children was identified as child rights. They said child rights are stripping us of our ability to be good parents because children had been taught you shouldn't be beaten. So when you get beaten, you report that person to the human rights worker. And then the parents, there are documented cases where parents said, well, maybe this child who's reported me to the police should go with the police, should live with the police. So from a child protection standpoint, it's the worst outcome imaginable. So the way in which we do our capacity building and the way in which we seed communities with outsiders, I would say, is not the best approach. And when it's used, when we've over-relied on it. So I think we heard this morning, in the previous panel, and what Patrick is talking about, is finding people on the inside, capacitating them. And it doesn't necessarily mean that these are going to be people who are going to earn university degrees, but they'll become more sophisticated, and they can learn from each other. But we need a different approach that's less didactic, less top-down, far more practical, and above all, respectful of local culture without romanticizing it. And I think if we do those things, we will transform, literally, the impact that we have.
Can I just make one more comment on that to plug again the deep listening that you talk about that I think we just often don't have time for. We work in a project-based world, and yet we are, all of us in this room, influential in our own spheres. And I'm not sure that's going to change anytime soon. So for example, with the Sierra Leone case, I know that one of the reasons why the parents would abdicate responsibility because of the child rights was that the child had violated their obligation, and their way, in the Sierra Leonean way of thinking, it was that, to be a child of mine, you fulfill these roles. Now, you violated that, and I have no more obligation to you. And I know that sounds cold and calloused, and it's not quite that simple, but that is a big part of understanding what the norms are locally. And when the child rights wedge was sort of driven between parents and children, we actually ended up creating child protection concerns in some cases. And so that deep listening and understanding, I think, is very, very important, and something we often don't feel like we have time for. But I think then we kind of go in and out, and then we leave, and we don't even know the kind of harms that have been left behind. So, but I'll stop talking. Okay, can we have one more question or comment, Adriana? Oh, sorry. Were there people over here waiting? Oh, go ahead. Thank you.
Hi. Sorry, I'm hiding. My name is Mathilde. I work for UNICEF in New York. But my question is on a previous experience. Okay, we have to report to donors, and we're very accountable on results. And we experienced that working with communities, they were like child protection communities. It was people who hardly knew how to write. And it was a huge challenge to get them to report. And they were doing a great job, but it was, just highlighting it, which was an issue. I was wondering if you had any comments on how to move forward on that.
Just quickly, in the work we do, what I was sharing is when we work with the volunteers and informal groups, we don't expect them to report at all. We don't even give them notebooks and say every month send us a report of what you're doing. However, the supervision structure is very critical. We would then have a social worker who goes in and engages with them through community conversations in the local setting and picks out issues of interest. Yes, some information could, drop through along the way, but we feel by asking them to report, then you're doing exactly what Mike was saying. As an external person, you're saying this is, an NGO volunteer. This is an NGO, so on. So, yeah. So we don't normally ask them to report, and we, based on the social workers, to pick out the information they require.
One way we've tried to manage is to embed in the communities monitors, and the monitors do participant observation. They live in the community. They go to schools. They go to places of worship. They do farming with local people, but they observe what's happening, and then they can prepare the reports. So I think that taking the burden, as Patrick says, off people who have low levels of literacy, and for whom, the world of reports is, that's a whole different system. It's the art of this work, I think, is keeping it about them, about what local people do, and finding some alternate way of getting the information we need to navigate our world.
Well, I'm sorry that we don't have more time to discuss. We thought we'd left a lot of time. I'm sorry for people who didn't get their questions, and please do come and talk to Mike and Patrick, because I think they have a lot more where that came from. So thank you all very much, and we'll move on to the next panel.
Thank you so much, Mike, Nicole, and Patrick. I feel like I could listen to all of you all day. It's such a shame that we have to move on, but we have another great panel of speakers. So let me introduce our next moderator, who is Jim McCaffrey, and he is he's the Alliance Steering Committee chairperson, as well as a senior advisor at Capacity Plus and TRG. So let's welcome Jim and the three panelists, who he will then introduce. Thank you.
is. Great. So we're going to change a little bit the methodology here, and rather than starting with presentations or long presentations or whatever, what we're going to do is try to have a panel discussion. I think it's been really exciting so far to listen to all of the presentations and the opening speeches. Again, it struck me about how diverse this workforce is that we're talking about. We heard different examples, and we started with some examples of programs where individuals were working with various kinds of clients, and different examples. You know, the child and youth care workers, the parasocial workers, social work assistants. We then heard about kind of communities and community approaches to it. So it's a very diverse workforce, and I think we need to kind of celebrate that diversity and provide the kind of support that will make everybody provide a component of the larger picture. So while this work happens at the individual practice level, it occurs within a context of a larger social service system and hopefully a supportive policy, legislative, and financing environment. It relies on partnership and collaboration at all levels between families, communities, the district and national government levels, community leaders, NGOs. So there really are a complicated web of stakeholders involved in this. And the real challenge becomes, you know, how best to have interventions and approaches that are coordinated and aligned and acting towards similar goals. It sounds really easy, you know, it's not so easy in practice. And luckily we have 3 examples of some programs and initiatives that we're going to be able to listen to a bit and then ask a number of questions to see how they're doing it. We have 3 leaders. Again, their bios are in the package. One is Joyce Nakuta, who is the Deputy Director in the Ministry of Social Welfare in Namibia. The second is Patience Ndlovu, who's the Botswana Initiative Country Director in Zimbabwe. And then the last is Dr. Bernadette Madrid, who's the Executive Director of the Child Protection Unit Network in the Philippines General Hospital and the University of the Philippines. And what we have, and as we can listen closely, is 3 slightly different approaches. And we were talking at the break, I was talking to somebody, and they were saying, well, how does change occur in all this? Doesn't it have to happen from the top? Doesn't it have to have the support of the government? Well, I think actually not. You know, I think it can happen in all kinds of ways. And I think what we've got is 3 examples, one of which change was initiated and supported and pushed by the government, another of which it came out of a university and hospital setting, and a third more of a bottoms-up approach. And so I think listening to this, we'll have some good examples, and we'll also have the ability to, you know, to look at maybe some of the common threads around what happened to make this coordination work. So with that, I've asked, for the first question, I've asked each one to say a few words about their program so that we can get a sense of what the initiative or what the program is, and then we'll go on there to ask about what were some of the ingredients, what were some of the challenges, and I'll involve you in asking questions also. So we want to just start and go from left to right? Nope, left to right, okay.
Okay. Thank you very much. Is it good afternoon or good after tea? I'm going to give you just an overview of the work that we are doing in Zimbabwe and how we are working across all the various levels that Jim was talking about. Also, how we are leveraging the funding from USAID and funding from UNICEF to do the work that we do. And also, interestingly, I mean, from the last panel, Mike was talking about, and I think Gretchen also asked the question of how do you link the formal with the informal systems? How do you link the traditional with the non-traditional systems? And I think for us, that's what has been working, and we can share that with you today. We have piloted a case management program meant to bring all the sectors together for improved quality service delivery for children at the community level. So the whole objective of the case management program, yes, we want to make sure that you complete the referrals. Yes, you want to make sure that you improve quality service delivery, but also to build the system of the Department of Social Services and have this seamless type of approach and ensure that children are getting services within a continuum of care. So you are looking at the kind of model that we have adopted in Zimbabwe. You're looking at linking the formal system with the informal system. So how do you work with community volunteers at the local level who are then empowered by the government system and well linked to the district level structures to support families and children. And then at the same time, how do you strengthen the capacity of the Department of Social Services, both from the national level as well as the district level, to be able to work very closely with the communities? So it's interesting that Mike, I think, spoke about humility, because it takes humility on both stakeholders, on all stakeholders, to feed one from each other. I think that is quite critical. And also, it also takes humility on the part of the donors themselves to be able to, give implementing partners the room to make these decisions about integrating the services, about supporting government structures to be more coordinated in terms of the service delivery. So we have, with the case management model, we've got volunteers who are called case care workers. We learned the approach from the CBND model. We visited them at some point before we started the model just to see how their child care workers, youth workers were working in South Africa. And then we brought the model and contextualized it to Zim. Now, the difference that we have between South Africa and Zimbabwe is that South Africa is more they have more resources than Zimbabwe. So the whole point was, how do you make this low cost? How do you make it cost effective? How do you come up with something that is sustainable within a resource constrained environment? I think earlier on it must have been Susan or someone else speaking about the ratios of social workers to children. And in Zimbabwe, when we started, we were at 1 to 49,000 because most workers, you train them and then they leave the country. So the idea was, how do you then create a cadre at community level that can take away some of the caseload at district level and strengthen that community structure, but having it well linked to the formal system. So for our Department of Social Services, the cadre that we have created in terms of the volunteers, we are calling the case care workers who are selected in the communities, very literate. We have a very literate country in terms of our literacy levels. So these people are able to actually do case management in a technical way. We're talking middle-aged people, we're talking young people who are able to do this, working very closely with the families. But also, lastly, just to talk about how integrated the whole system has become. I think as World at Botswana in Zimbabwe, we are very privileged in that we are receiving we are running three big national programs with funding from PEPFAR and also funding from UNICEF. So while we piloted the case management program under USAID funding in a previous in a project that we ran from 2008 to 12, the model was then taken up by UNICEF to scale up in about 11 districts, and now we have more funding from USAID to scale it up to even, more districts. So the whole idea for our Department of Social Services is that we need to have this case management approach implemented in all our 65 districts in the country, because now the program has been taken up by the government. It is owned by the government. We have worked with the government to build their capacity to place social workers in various districts, and through an investment case and the evidence that people are seeing on the ground, we now have our Treasury putting more resources into the whole social service workforce. And I think I will talk a little more about later on, I think, about how even with some of the programs we are implementing, workforce strengthening programs with PEPFAR funding, how all of this is feeding together, because you cannot strengthen just the community level structures and then you ignore the other levels. So while you're strengthening the community level structures, we also have, coordinated strengthening at the national level, where we're dealing with supporting government to come up with protocols, referrals, standards of childcare and so forth. At the same time, we're working with professional bodies, National Association of Social Workers, to provide us with interns through an internship program. We're also working with private sector where we don't have resources to support some of the services that we need support for the children. And we're working with universities as well to build, diploma programs, certificate programs. So it's a very integrated and coordinated system. But I think it's because we are just privileged that, we are in a unique position where we're getting all this funding from the various donors, and that funding is leveraging off of each other and providing the kind of impact that we are seeing to the children. So I think in a nutshell, that's what we're doing, and, we'll hear more with the discussions.
All right, thank you very much, Patience. And I think we could get just an image of all the various stakeholders that they're involved with, and also the idea that you just brought up at the end around taking more of a systems approach to a particular change process as opposed to just one element of it. And I like the word humility, which you used again. We don't always hear that used. We've heard it twice this morning. All right, so Bernadette, you want to talk a little bit about the Manila and the Philippines?
Yes, we are about protecting abused children. And so before we started our program, we asked the question, what do abused children need? Okay, what kind of services, what resources, and how do we put them together, and what kind of delivery system that will be? And so based on our needs assessment at the university, we decided, together with the people that who feedbacked, you said, oh, this is what we think the abused children needed. So actually, it's not, new. We found that they needed medical services, they need psychosocial services, they needed legal services and support for their families. And so we decided to put them all together under one roof in a child protection unit. So as most programs develop, it started as a pilot program at the university, putting together physicians, social workers, psychiatrists and psychologists, and police, and a lawyer under one roof. Now, it worked, so when I say it worked, that meant that children were brought to the hospital, the re-abuse rate was low, and it increased reporting. And so the next question was, so how do we scale it up, knowing that resources are not the same across the country? And so the delivery system that we chose was health, but then the different personnel came from different departments or ministries. So that meant having collaboration with all of these ministries so that they would allow their workers to work together under one roof. So in the beginning, it was mainly a memorandum of agreements from the national level, and looking at which government hospitals, this could be done. It took quite a while, and at different levels, the different services were not the same. But now I think the idea has caught on, and the Department of Health has come out with a memorandum order, and the police have come out with their own different reorganization of their divisions. And for social work, it could either be from the hospital or from the local government, and that needed legislative action from the local government. So a lot of advocacy. I think that for collaboration to happen, people have to see that there is mutual benefit. I don't think that anyone will collaborate if they don't see any benefit, or that there is a career path for them to take. What we wanted to take away was that this should just become volunteer work. because volunteer work, so what's the standards? You know, how do you keep it, how do you grow it? And how about, you know, monitoring? Who is accountable? So we wanted an institutionalization of the child protection units. And then, of course, at the same time, you cannot prevent the child, you know, take a child and not look at the mom, because women also have been battered and have also been abused. So it's now women and child protection units working together as one, under one roof. And so the goal right now for my country is that within 2 hours, any abused child or abused woman would have access to services provided by trained personnel. And since we are an archipelago with 7,100 islands, geography is a challenge. Of course, the human resource development is another challenge. But right now, we have 62. Out of that one, there are 62 child protection units covering 64% of the population. And by the end of this year, we will be able to cover 84% of the population. And by 2017, almost, I wouldn't say 100%. It's difficult to achieve 100%, but we're getting there. And so to get there, we really needed advocacy at all levels, from the community up to the national government. And you really have to deal where the power is, and that's government. And you need credibility to be able to deal with governors, you know, with congressmen, with senators, because they're the ones who provide the budget and the line items. Any program that has no personnel and has no budget is short-lived. So really, I think that to institutionalize, we cannot go without government and going through all of those different advocacies. I will just stop there. I'm sure there'll be questions later.
Okay, thank you, Bernadette. Again, so think of that, 62 units, a physician, social worker, police, mental health professional, and when needed, a lawyer. So thank you for that, and we'll come back with questions. And now over to you, Joyce.
Thank you. Thank you, Jim. I'm working for the Ministry of Gender Equality and Child Welfare, and my responsibilities are mainly around programming for child protection. So in many Southern African countries, we know that our service delivery, our focus was mainly predominantly direct service delivery to children. And in recent years, we have actually moved away from that, because we realize that when we as government get funding, we decide where the funding should go to. UNICEF give us funding, and we decide we give the funding to the northern regions where there's an issue with child-headed households, or USAID give us funding. We go to the south where there's an issue with health outcomes, and there's no systems and sustainability within those programs. So in recent years, we were moving away from direct service delivery into working towards a more comprehensive national response, with our emphasis on really building systems and strengthening our national and local capacities. But most importantly, to embrace partnerships, because we realize that when we decide where funding should be spent, there's no sustainability and there's no long-term outcome for that. So, and I think it's key for us in government to realize that partnerships is very important. So we shift our aim to ensure that in our building of systems and strengthening our national and capacity buildings, our programming is HIV sensitive and it is integrated, so that at the end we fulfill the rights of our children. Now, coming to how do we do that as a government, we have what we call the National Permanent Task Force on OVC. And this is a multi-sectoral response to making sure that there's national responsibility, and there are systems that are built on consensus at national level. So we have different types of organizations that are part of the Permanent Task Force. Here we are talking about civil society organizations. We are talking about international organizations like REPSI and Project Hope. We are talking about development partners like USAID and UNICEF. And then also government line ministries like the Ministry of Education, the Ministry of Health, the Ministry of Safety and Security, the Ministry of Justice. Now, in making sure that what we are doing within government, in linking our different programmings and making sure that all of us are promoting an integrated service delivery system, you can imagine all the different role players coming together and having their own priorities. Imagine working with an international NGO that do their proposals and fundraising and not consulting government as to what they will be focusing on. Coming into a meeting and wanting to achieve, what they have promised their donors to achieve. And then you are there as government trying to pull all these different stakeholders together and making sure that your priorities are achieved. It is a challenging task. But in working over the years in partnership with the different levels of organizations, you learn that you have to embrace, and the most important thing is partnership. So in linking the different systems and making sure that we as government are central, we are giving the right guidance, we are lobbying the right people, and we are also lobbied in the right way, it makes us it's helped us at the end to promote children's rights so that we as a government are seen to be doing the right things.
Okay, great. So, three good examples. Now, the question that I thought we'd start with is, and you talked in the end, Joyce, about having to embrace partnerships. Bernadette, you were talking about the kind of formation of these teams originally and on a pilot basis, and patients. I mean, when you were starting at the district level in some ways, but then with a whole range of stakeholders. Could you describe one of you, not in any particular order, a particular ingredient or action that you took that showed that, for example, that people should trust in the government to embrace that partnership? It's one thing to say, we're trying to promote a partnership, but what kind of actions that help promote that?
As I always say, that the proof of the pudding is in the eating. I mean, it's very nice to say, that we put together all of these teams and then doesn't work. The children and the families who come in don't like it, or they're not helped at all. So I think what made it successful was really seeing to it that the first child protection unit really knew what it was doing. You have well-trained personnel and who really did their job and who were highly motivated, because once people see that and they see the results, then it was easy to advocate and to lobby that this is the model, as was said earlier, that can be franchised. So for us, the convincing was in the first 5 years.
It must also have been rewarding to the people who were involved in providing the services because they could see it was working. So.
Yes, definitely. And the relationship between the different members of the team, I think that it's very crucial that they work together as a team, that they respected each other, and they really collaborated and learned to trust each other. I think the first 5 years, I said, was critical in that.
Well, I was going to say, I think it's pretty common for physicians, social workers, police, and mental health professionals to work together without any problems.
We had to understand, each other's limitations as well, not only what we can do, because then it would really, the fights that can result in can also be destructive.
I just want to build on what Bernadette said in terms of, the test of the pudding is in eating it. It's about evidence base. I think it's important to show that there is evidence of something that is working. And for us, it was taking time, about 2 years, in piloting a model, working very closely with the government system. And I think because we are an INGO implementing partner, working with the government and having government buy-in into something that you are seeing can work on the ground, and they are part of the model testing of what you are doing, is very, very critical. So engagement and advocacy at that local level, and trying to work, engage all the different sector ministries, because I think for the work that we are doing, it's not just about the Department of Social Services. You have to engage all these various players and everybody, and trying to get everyone to understand the model and understand integrated programming and the importance of coordination and the results that come out of coordination and the impact that you have at the end of the day. So it's about that engagement, that advocacy, and the evidence base. Once people see that it works, they come on board.
Certainly.
Also, in setting up a structure like the Permanent Task Force that is led by government, it took us many years to get to a level where we have consistently the same people coming to the meetings and believing that there's progress, there's buy-in from government side, and there's belief in that we are moving forward in terms of decisions that were made at previous meetings, for example. So I think for partnerships to be built, it takes time. It takes years especially for international NGOs, and sometimes even for civil society or local civil society organizations to believe in what we are doing. But it can happen. It happens.
Yeah, I would just add that key ingredient about a consistent number of people coming to these meetings, because what we've seen with both the health workforce and this one is if you have a group, a permanent committee of some sort, but there's a constantly shifting number of players that come to it, people begin not to see it as not being a useful function. And the other thing around the proof of the pudding is in the eating and the evidence base. Again, it talks to a strong need for more kind of monitoring and evaluation in this area. And I was curious, how many of you are involved or interested in the M&E section of this? So we have Great. It is one of the kind of interest groups that the Alliance is about to launch, is one on promoting and finding and identifying and discovering more evidence. So, great. So, another question, and then I'm going to open it up here. If you looked at what's the biggest challenge you faced in trying to create this sort of environment where people could cooperate in the ways you're talking about?
Different things. For the different sectors, it was different things. Like for the doctors, for example, to change practice on how to do even just the plain physical examination of an abused child. For them to accept that they're not doing it the correct way, and they think they're the expert. And even to think that child abuse is a health problem and not just a social work problem. That took a lot of convincing, and that meant dealing with the professional societies as well. And including it in, then you go into the curriculum, undergraduate curriculum, and so forth. And when you talk about the police, changing practice within the police force is very difficult. But then you have to find out that the police is a hierarchical organization, wherein the general has a lot of say. And so if you convince the general, it goes down the line pretty quickly. When you look at the lawyers, it's the Supreme Court. So what the Supreme Court says is immediately like the law. So we deal with the Supreme Court. And when they bought on, everyone followed quite quickly. So it's really recognizing where the change can come from.
Yeah.
Yes, what you can leverage, and that's what we go for.
Now, Bernadette is a physician. You didn't describe how you change physicians.
First of all, really, it's as I said initially, it's a question of credibility. So the first people who did this work were highly qualified, came from training programs that were well respected, and so what we said was believed. It couldn't have come from somebody who was an unknown and was not accepted by the society. So it has to come from a leadership position, is what I might say.
All right.
For us, in being a coordinating body like the Permanent Task Force, you need something to coordinate. If you bring people together, number one, they need to have an interest. They need to have buy-in in what you are doing. So our biggest challenge as a ministry coordinating children's issues in the country is to get that consensus on what is it that we come and discuss and what is it that we at the end wants to coordinate. So we needed to decide on one type of an agenda. And what we have done is to develop what we call a national agenda for children that is comprising of a document that are promoting children's rights. And all the different organizations, be it an international NGO, a local civil society organization, a ministry, the development partners that are working in the country, they contribute towards developing this national agenda for children. And once we had that, it was much more easier to really coordinate and work together.
Okay. So again, a challenge there is finding something really important to coordinate so people see it as worthwhile for the kind of the level of people that you want in that kind of body. Patience?
Yes, I think it's more or less the same. It's because people are so much used to working in a siloed approach. And you are trying to get everyone, to have the same common goals and vision. So it takes a long time to get people to come together and rally them around a common vision and a common goal. So we're talking different stakeholders, there's different civil society organizations that are involved at community level in meeting all these services for the kids. You're talking about different government sector ministries and so forth. So it takes a long time to get everybody to rally around that one common cause and see, the benefits in doing integrated work and integrated service delivery at that community level. But not just at the community level, the national level as well. Right now, what we are working on with the Department of Social Services is to now get all the different sector ministries to come on board, because sometimes at the district level it's a bit easier in that as long as you have one key government ministry that is driving the agenda, they bring everybody together at that local level and people quickly buy into something that you want to work on. But at the national level, where each sector ministry is pushing its own agendas, Ministry of Education is talking about education for all by 2015, Ministry of Health has a different focus. But how do you get all those people to rally behind this common vision and still say, as Ministry of Health, we have a part to play in social service delivery, and therefore we should be part of it. So that takes a lot of engagement because of the competition too that is happening between the various sector ministries at that level.
It is interesting that in some ways it is easier to get that kind of cooperation at the community level closer to what's happening than at the national level, where you have budgetary issues and policy issues and so on to fight through that. So Let me ask, go ahead. Yes.
No one asks about how about the social workers? I always said that from the beginning that our social workers, I don't know if you will take this badly, but I said they were like the amoeba. They can take on any form. So whatever was lacking, we said let the social workers do it. Because, you know, the doctor is pretty well defined, the police is pretty well defined, same with the lawyers and the police. But the social worker, they filled in all the little niche and crannies that no one else did. So right now, for example, because we're very short in mental health resource, we're developing the social workers to deliver the mental health part, like cognitive behavior therapy. So they were the ones that glued everything else.
All right, so there's a new image, a social worker as amoeba. Okay. Let me ask any questions from the audience for any of this, or anywhere. Ori, you've taken over Gretchen's role here as the...
Well, first I want to say I'm thinking about amoebas differently now. I'm much more affectionate towards them. Well, I don't think that I realized how much I would learn today. I feel like this is a topic that I have been thinking about for a long time, but I've been really challenged by a lot of the things that I've heard the speakers say today. And what I'm struck by is how, you kind of summed it up for me at the end just now, Bernadette, but social work and kind of the social service workforce and what the workforce does is a real art. You know, there's in many ways, the lawyers, the doctors, all of that is much more defined, but social service workers have to kind of work kind of in the at the intersection of so many different communities. There's Mike and Patrick talked about how the social service workers have to be able to speak a range of different languages. They have to work with the traditional communities as well as the more formal institutions. And here we're talking about government at different levels and different types of government in different sectors, and social service workers have to do so many different things. And then I'm also remembering a conversation that we had yesterday, Patience, about one of the things that we're learning from the violence against children's studies, and particularly the one in Zimbabwe, is that the children, the population we're talking about today that we care so much about, is sometimes a perpetrator of violence against other children, and how my tendency is to think about people in terms of good and bad and my job and not my job, and how social service workers have to kind of see the whole person as well and work with the whole person and work with the community, not to divide it into the bad people and the good people, but to continue to maintain kind of a balance within the community and a peace within the community, and how hard that is. So anyway, my question. Sorry, that was not a lot of commentary. I'm sorry, I'm feeling like maybe the need to have therapy now to kind of debrief my session with you all today. But I'm challenged by that and how to talk about that, because I feel like one of the things that we struggle with within the social service workforce is articulating what we do. And I feel like today I'm coming away maybe even less clear about that and how to talk about that. So I wonder if you could help us we started with a definition of the social service workforce and what they do. I wonder if we could come back to that and you could help us think of a way to define that in maybe a broader way, and talk a little bit about this art of social service work.
I'm trying to digest all of that. But I think you're very right when you call it the art. It's a real art. And when I was listening to the previous panels, the social service workforce is like an ecosystem of its own that is linked to all these other sectors. And you almost have to become a jack of all trades and a master of none, because we know that doctors, are doctors, and, lawyers are lawyers. But when we are doing social service work and you have children who have health issues, you have to get an understanding of basic health care, pediatric ART. We often laugh in our office when we do proposals because now you have to understand what, the rates of pediatric ART uptake and all of those, critical issues. So I think it's really an art of bringing everyone together to rally around issues, social issues, in relation to children and families. And I think the critical role we play is a coordination role, because everyone is so siloed in their way of doing things. Doctors are doctors, they just do doctor stuff. They are not thinking about what are the other broader social service issues out there. So I think we have a critical role in coordinating all of these players to ensure, comprehensive child well-being. I think for now that's what I could say. Yeah.
Yeah, I also think that the art in providing a workforce that really responds to what is happening at the different levels is complicated, and you need to recognize that in different communities it is perceived differently. I think for us, what we see as the workforce and what we have been trying to develop the last couple of years in making sure that at community level we have people that respond through psychosocial support. It has been at government level recognized as these are the social workers. Why do we need more social workers? We don't need to train any more social workers or make provision in our structures for more social workers to be employed and register with the Social Workers Board. So I think it is really an art. The important thing is really at our different communities and in our different systems, there should be recognition for people that are doing work that meaningfully contribute to the uplifting and the protection of our children.
If I can also add, just looking at the landscape of social work practice in our country, for example, there is now a shift in revising even the curriculum, the social work curriculum. Right now with PEPFAR funding, we are supporting the revision and the review of the social work curriculum because you can clearly see the shift. In prior years, there was such a focus on statutory and probation work. But now you have to shift that because these social workers have to deal with developmental issues, sustainability issues, get an understanding of the various areas of service delivery from health to education to legal, all of those pieces, and yet they are not trained for that when they go to social work schools. So we are also changing that, the curriculum, because you can see that these people are quite critical, but they do not have enough to respond to the issues that are emerging from a developmental and a sustainability type of approach. Yeah.
Great.
Can I add and say, why can't the social worker just be a pluripotential stem cell that can that can develop in any way to bring about social good, be it individual change or societal change? I mean, that seems to be what it is.
First it's an amoeba, and now it's a stem cell. Anyway, this is terrific. It is now kind of getting towards the close, so this was great, and I want to thank all three of you. This was terrific. Thank you. You can wait just a second. I'm just going to say a few final words, and then we'll wrap up. Going back to Susan's talk at the beginning, I thought she found some wording I liked about the basic goal of what we're about, which is promoting the resilience of families and children. In some ways, that turned things around and made a very positive approach to it. I mean, it's positive to say child protection, but somehow promoting the resilience of it just struck me as being really great. I think just listening to all of this, kind of the need to recognize and celebrate and support the diversity of the workforce at its different levels, and we heard lots of examples of that. Secondly, the working around making the appropriate linkages around trying to create some synergies at different levels, complementarity, cooperation. Again, very, very important. So for me, those are two kind of images that come through, as well as the kind of different metaphors for the social welfare workforce. Just some thank yous for all the speakers and panelists who participated this morning. In particular, I want to thank some people that helped organize this. Amy Bess, who I think you saw around with names, so let's give her a name. And I think some behind the scenes, Alex Collins, who's sitting there behind the pole. Alex. And Ann Yang where's Ann? She's back there. Thank you, Ann, from Care Health. I also wanted to thank Maury Mendenhall. In particular, Maury has been a staunch supporter of social service workforce strengthening for 4 years now, but certainly the last 4 years. But it's two things. One is the support is enthusiastic support. It's also substantive support. So I've enjoyed the interaction with you over the last 4 years, and I think we've all benefited by that. So this is terrific. And last but not least, to PEPFAR and USAID and to the NASAW Foundation, National Association of Social Worker Foundation, for helping to fund this. So terrific. Thank you, everybody. That's it.